Hello and welcome to Let's Talk Climate, a webcast series from ecoAmerica. Featuring dynamic discussions with local and national leaders offering diverse perspectives, Let's Talk Climate brings forth the latest thinking and best practices for building public support and political resolve for equitable climate solutions in the U.S. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica, joining you just outside of Washington, D.C. on Nacotchtank and Piscataway land. And today we are bringing you a special episode digging into some research from the Environmental Defense Fund that explores the local impacts of air pollution and the resultant health disparities. I'm joined today by Dr. Elena Craft, Senior Director of Climate and Health at the Environmental Defense Fund. Thanks so much for joining me.
Thanks for having me, Rebecca. Nice to be here.
Yeah, and so I wanted to start by asking you to talk about some of the top line findings from the study that EDF did and the disparities it revealed.
Sure. Well, first of all, I just wanted to mention for all the listeners out there, it may not be in their day-to-day thinking, but around the world, 9 out of 10 people breathe unhealthy air. And air pollution is actually now the biggest environmental risk for early death. It's responsible for around 6 million premature deaths each year. And so that provides some of the background context of why our organization is really interested in trying to understand more about the disparities from exposure to different types of air pollution. So basically what we did in this study was we used a combination of satellite and local air pollution data and health data. And this was done in partnership with George Washington University. And we came up with a detailed analysis of the impacts of local pollution in the Bay Area around Oakland. And what we found actually was that more than 2,500 lives are lost and 5,200 children develop asthma each year due to traffic-related pollution, specifically from nitrogen dioxide exposure. And furthermore, what we found was that those burdens, the exposures, were not distributed equally. In some areas, death rates from pollution were more than 30 times higher than in other areas. And while traffic-related air pollution accounts for an average of 1 in 5 new childhood asthma cases around the Bay Area, pollution is responsible for up to 1 in 2 cases in some areas. So it really shows you how where you live is a determinant of the type of exposures that you might get from air pollution.
Yeah, absolutely. We've heard on this broadcast before that your zip code has a greater impact on your life expectancy than your genetic code. And a lot of that is because of the built environment and the policies that surround a neighborhood, not necessarily any biological susceptibility. Is that did the study that EDF did sort of have, sort of match that conclusion, that statement as well?
Right. I mean, absolutely. I think, we are used to seeing how where you live is a determinant of your health, and that is not distributed equally across the country. And so what I think has been challenging in the past, and what we're really trying to drill down to understand is, air pollution is generally reported at a county level or city level. And ultimately, that doesn't really address the exposures that are happening at the neighborhood level or the community level. And so what we really are trying to do is understand, okay, in these neighborhoods, particularly neighborhoods that may be hotspots for pollution, what is driving that pollution and what solutions can we put forward to mitigate that pollution?
That's so important. That topic, sub-county level data analysis can sound kind of nerdy, and but it's really important to dictate sort of, for us to understand that local exposure that we're getting and how where we spend most of our time, really influences health outcomes. And I think that's really what I wanted to get into next, actually, which is the connections between local air pollution and climate change. EDF study focused on the Bay Area, as you mentioned, but there are, of course, other areas across the US with a similar landscape of concentrated air pollution. So connect the dots for us. How are local areas of concentrated air pollution related to climate change?
Well, I think, especially over the last couple of years, especially with the wildfires going on, the flooding, all of these extreme, extraordinary weather events that are happening across the country are tied to a warmer climate. And I think all of the predictions that have been made from IPCC, our researchers around the globe have highlighted that, look, these are the things that are coming. These are the ways in which we are going to have to learn how to live and adapt in this new world of a warmer climate. And so I think one of the things that has that we're trying to understand more about is, we know that climate can contribute to increases in air pollution. The way that that connection is actually in a lot of different ways. If you're living in the Midwest, if listeners are living in California, for example, obviously their day-to-day lives right now are really focused on wildfires and trying to protect themselves from exposure to the particulate matter that's associated with all of the smoke coming from these massive fires. If you're living in a place like Houston, where the hurricanes are projected to be supposed to be a very active year. What we've seen when hurricanes do come through is that oftentimes they cause damage to facilities that causes releases of different kinds of volatile organic compounds. And so there are exposures associated with lots of different things that are happening as a result of that warming climate. Obviously, flooding in the Midwest is contributing to flooding at facilities and so forth. And so there are lots and lots of different ways. And I don't even think we understand all of the ways in which climate is really impacting our day-to-day exposures.
When it's both that climate change exacerbates that it can concentrate localized air pollution, but also that we rely for a large part for our energy on fossil fuels, and the production of energy from fossil fuels can also create local air pollution. Is that, and then you talked a lot about highways, living near highways with gas vehicles. I say that because it was interesting, on a prior episode, we heard about imagine a world of electric cars, that traffic related air pollution could actually go down. Living near a highway might not be as much of a risk factor if you're dramatically reducing tailpipe emissions, right? So it's both that climate change is exacerbating that local air pollution, but our reliance on fossil fuels for energy, which is a contributor to climate change, then, but the facilities that are those energy producing facilities relying on fossil fuels increases that concentrated air pollution as well. So it's kind of like that double whammy, right?
Right. And I think, that's why we see some of the actions that we've seen from the current administration. So, for example, the infrastructure bill that includes funding for charging infrastructure across the country, the priorities around getting EV trucks and cars out into, across the nation. Those are all policies really designed to help us move away from those harmful climate pollutants that are created both at the front end, which is, even accessing those fossil fuels, and then at the back end, combustion of those fossil fuels in the end use.
Right. No, and we've talked before about climate anxiety and sort of this, this problem is overwhelming. What can we do? And I think electric vehicle charging stations is actually a really important thing. My dad's climate anxiety definitely manifests in, am I going to find a charging station in between the two areas? Because he took the step, he invested in the electric car, and now he's a little bit neurotic, and he listens to these sometimes. So hi, Dad. But he is worried about, is there going to be a charging station? Can I go as far as I need to go? The answer is yes. But it's sort of mapping that out for him and figuring out where the charging stations are. And so if they're more ubiquitous, it'll be easier for people to invest in the electric cars and be able to travel where they need to go and sort of fuel up at a, sort of without worrying about it.
Exactly. I mean, and that's where the country's going, right? I mean, technology is leading us to these kinds of solutions. So I think it's understandable to everyone, right? I mean, change is difficult, and especially a major change, like going from a gasoline powered car to electric car, battery car. It is a change, but I think it's a change that we understand as a nation needs to be made if we want to preserve the quality of life and the public health benefits and so forth that we have, that we expect in a first world country. So I think those are all really important factors in terms of how can we lead this nation forward, and we each have a role that we can do as individuals to help meet that larger goal and to help move the country in the right direction.
And you got at this a little bit earlier when you started to talk about different regions of the country, but this particular study was done in an urban area. But we do know that suburban and rural areas are also experiencing climate impacts. So what universal conclusions can you draw from research like what EDF conducted recently?
Well, there is a lot of interest, and I think we see this in the infrastructure bill, for example, where we are trying to understand more about the quality of air, particularly in rural areas where there isn't a big network of, or maybe not even, they might not even have an air monitor. We've seen communities taking initiatives of their own to install monitors in their neighborhoods to learn more about the quality of air that they're breathing. I think, we are seeing a sensor revolution across the nation where people really are concerned and they want to know, particularly in places like California and the West, where these wildfires are impacting lives daily. And so having access to that information in a transparent way. I mean, we still need to understand more about how to analyze and understand the data. I don't think that that's that's not a small task, but all of these individual pieces are adding up to give us a larger picture, a more finely resolved, more granular illustration of air quality in our neighborhoods, in our communities across the nation. And that is very exciting. I think that's something that I'm looking forward to seeing as we move, in this direction.
Yeah, and actually ecoAmerica's research shows that there's broad agreement across urban, suburban, rural communities that clean air is a right. And that we also have a moral responsibility to our children and future generations for them to have clean air as well. And so what are we doing now? And I feel like what you're getting at with understanding that localized air pollution can also then help define more specific solutions in areas these aren't cookie cutter solutions that work in every neighborhood. So understanding that the different levels of air pollution, sources of air pollution, locally can help further define solutions that can be locally implemented as well.
Exactly. And I think another piece of this is really understanding about the fact that air pollution doesn't have any boundaries. So just because you are getting exposed to air pollution doesn't mean that it's actually coming from near where you live. It could be coming in from hundreds or thousands of miles away. And so it's an issue that we have to handle globally. I mean, honestly, globally, just like climate issues, and in a way in which we're bringing everyone to the table to identify solutions, to drive innovation forward, to help develop new technologies, to help to mitigate the very serious issue of air pollution around the world.
And so I feel like we've given folks a lot to think about. The study really digs into this idea of local air pollution and health disparities. So what can we do? What should we do with this information? And how can we use now what we know to build health equity?
Well, there are a lot of things that individuals can do. I think being knowledgeable about policies within your local community at the state, national level, for sure. Looking at if you are in a vulnerable population, which is over half of the population, if you really think about it. I mean, we're talking about kids, we're talking about elderly folks, people who have chronic respiratory or cardiovascular disease. I mean, there's no, and obviously, we're layering all of this on top of COVID and the pandemic, which is exacerbating, kind of everything across the board. And so really staying in touch with what your local communities are doing and to push for those climate action plans. We know that some of the cities around the country have developed plans and they're implementing ideas and strategies. So even things as simple as making modifications to the buildings around your city, those are super important in terms of helping to reduce those climate pollutants. But then also really supporting some of the policies nationally. So as we mentioned, transitioning to electric vehicles, decisions about your personal investments, for example. There are a lot of investment opportunities out there that are trying to push these new technologies forward, that are trying to be more socially minded in terms of, okay, well, how is my 401k invested? Is it heavily invested in the fossil fuel industry, which has contributed to obviously a lot of our climate issues? Or are we more forward thinking in how we're making decisions about where we spend our money? Even making decisions about how are you getting your Amazon package? Are you, getting it next day, or are you getting it on your delivery day? I mean, those small things, when you think about the number of people, 330 million across our country, those things add up. And so being more mindful and conscious about those things, I think those are all things that we could each incorporate into our daily lives.
I think that's great to have such specific examples to start doing today, right? I mean, these are things we can do today without any inconvenience to us, really, that will add up to this bigger difference. And so I just want to say thank you so much, Elena, for spending time with me today to share your wisdom and concrete actions for folks. Please join us every Thursday for live episodes of Let's Talk Climate. Engage with us online with the hashtag Let's Talk Climate, and be sure to subscribe and follow us on our social channels for the latest thought leadership, resources, and episodes on climate action and advocacy. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, and get active.